But at least we should start asking the questions, the right questions, and try to take in steps. It will take time, it will take a lot of effort, but it will take a lot of us to change this paradigm that accepts and normalizes some of these practices.
If we have given you 10,000 doses of antiretrovirals for HIV patients, why do you have 22,000 saying they have not collected their medicines this month?
Hello viewers, welcome to Corruption Must Go, ICPC's weekly television program. I am your host, Murna Barnabas Atiai. All Nigerians everywhere have the right to achieve the highest attainable level of health. This is the fundamental premise of primary healthcare system that provides quality and comprehensive healthcare in a cost-effective and equitable manner. In this way, government at all levels must make sure that every citizen accesses the best possible standard of health. It is in this vein that the ICPC, in collaboration with the Federal Ministry of Health and other critical stakeholders in the health sector, organized a one-day conference with a view to profiling solutions to the corrupt practices and other related offenses in the health sector. The conference themed Corruption-Free Primary Healthcare Delivery for All is our focus on today's program. Meanwhile, Ruth Awodi is standing by with anti-corruption stories. Over to you, Ruth.
Welcome to this segment on anti-corruption stories. I am Ruth Awodi. ICPC has arraigned the duo of Mrs. Ndubisi Joy Chineme, a staff member of the Federal Ministry of Trade and Investment, and Mr. Godwin Sabo Takat of the Federal Ministry of Works and Housing over allegations bordering on obtaining by false pretense and employment racketeering. The duo brought before Honorable Justice C.O. Oba of the Federal Capital Territory High Court 31 sitting in Apo, Abuja, accused the defendants of defrauding unsuspecting job seekers to the tune of over 12 million naira only. ICPC, in a 9-count charge, accused the defendants of jointly obtaining the said amount from their victims by false pretense. Their actions, according to the counsel to ICPC, Mr. Nura Seidu, contravened Section 1 of the Advanced Fee Fraud and Other Fraud-Related Offences Act 2006, Section 18, Subsection D of the Corrupt Practices and Other Related Offences Act 2000, and Section 363 of the Penal Code Act 1990. After the counts were read to their hearing, the defendants, however, pleaded not guilty to all the 9-count charges. Counsel to the two defendants, Mr. E.E. Oga and I.O. Nweze, filed separate bail applications and pleaded with the judge to admit their clients to bail on very liberal terms pending trials. Mr. Seidu, counsel to ICPC, did not object to the bail applications made by the counsels to the defendants. Justice Oba thereafter admitted the defendants to bail in the sum of 2 million naira with 2 sureties for each of them, who, each of the sureties, must have 20 million naira in their accounts and 2 landed properties in the FCT to be verified by the court. He ordered that the defendants be remanded in Suleja and Kuje Correctional Centers pending the fulfillment of the bail conditions. The judge later adjourned the case till 13th January 2025 for the commencement of trial. That will be all on this segment. Corruption Must Go continues with Murna. Stay with us.
Corruption not in my country.
Good afternoon, sir.
Good afternoon, madam.
My name is Alero. I am not sick. I just need you to help put your stamp on this medical report. I want to tender it at my office as a sick leave. I'll pay 10,000 naira.
Ma'am, that is impersonation. I'm not a doctor.
Oga, Be like say this English no go pay. I go increase the money to 20,000 naira. I beg. You know, if I give you that 20,000, as you wide, so you know, if it still help your condition more. So you know, say you spread well.
As I spread like virus, I mean.
You talk about.
Come out! If person come your hospital, talk to make you give am fake medical report, make you go take collect sick leave. Talk and say no, na corruption, not in my country.
Stop corruption now.
Corruption not in my country.
You're watching Corruption Must Go. To declare the conference open, the Minister of Health and Social Welfare, Muhammad Ali Pate, CON, stated that the challenge in the health sector was systemic and multi-institutional, and which he said is also linked to state capacity and individuals.
In health, which is just one sector, and sometimes it's difficult to isolate corruption in health from wider issues of corruption across different levels, whether it's in what happens when you are trying to put the budget, or whether with those who are mandated to look and clear whether you go and do the procurement and how you do it, whether the guy who is supposed to sell the form for the contractor or the one who to register, who collects something and leaks it to someone else, whether those who are supposed to evaluate it and agree, or who are to push it from one level to the other, or even when somebody does the work, whether he or she gets paid what is due on them, or whether when it's delivered, this store officer signs it and confirms that in fact it's verified it's been done, or even the people who get it and whether they accept or channel it to the markets like happened with this development finance. So it's a grave issue, and I was having them in my mind and struggling with it. Then your letter came. So I said, this is a meeting that I have to attend, because I don't think we have we don't have easy answers, but at least we should start asking the questions, the right questions, and try to take in steps. It will take time, it will take a lot of effort, but it will take a lot of us to change this paradigm that accepts and normalizes some of these practices.
Chairman of ICPC and chief host of the event, Dr. Musa Adamu Aliyu SAN, in his remarks, noted that the conference was organized to stimulate discussions that will improve service delivery devoid of windows for corrupt tendencies in the health sector.
This conference also serves as a veritable platform for mobilizing participants to embrace the national ethics and integrity policy, which is critical to reshaping our lifestyle in a manner that ensures the nation benefits from saner behavior, so that future generations will appreciate us for bequeathing a more conducive and productive environment to them. I hope that at the end of this conference, participants will be equipped with the necessary attitudes and tools to help diminish corruption in primary health care. Indeed, this conference offers us the opportunity for more collaboration in our quest to rid Nigeria of corruption and strengthen our system for better output.
I am a Nigerian, a highly cultured race. My culture abhors corruption, and with my integrity, a new Nigeria is possible. I say no to corruption today to build a future for my children. Join me and imbibe the culture of integrity to build a Nigeria of our dreams.
The keynote speaker, Federal Capital Territory Authority's Mandate Secretary, Health Services and Environment, Dr. Ade Dolapo Fasowe, in her address, decried how corruption has hampered and continues to bedevil the primary healthcare service delivery in Nigeria, saying that there was need to adopt the public health approach to making the primary healthcare corruption-free. Let's hear her.
What we are trying to do now is to improve transparency in the application of government and developmental partners funds by the SWAP, sector-wide approach. What that means is that every money coming into the health systems will go simply into one basket, and from one central system, we can see who is spending what on what. If you have spent 1 million naira on malaria this month, it will be clear. Why do you have 2 million people sick of malaria? If we have given you 10,000 doses of antiretrovirals for HIV patients, why do you have 22,000 saying they have not collected their medicines this month? That is what the sector-wide approach will do. The sector-wide approach will also help curb corruption by ensuring that if development partners are coming into the country, peradventure, I know someone and is interested in dealing with tuberculosis, and I say, just bring the money, we'll deal with it anyhow. Tuberculosis is not endemic here in Abuja, but because I know him, he will bring his money. When there's malaria, there's hernia, there's diarrhea, there's all sorts of things. Sector-wide approach would stop that from happening.
The technical session at the event had seasoned panelists drawn from key sectors who spoke on oversight function and corruption-free healthcare delivery for all, deepening professionalism and integrity for corruption-free primary healthcare delivery, promoting free primary healthcare delivery process, patients' voice and participation, human dignity and reducing patients' wait period for a more friendly primary healthcare delivery, the unlettered, engendering corruption-free healthcare benefits, media's role in engendering a corruption-free primary healthcare delivery in the FCT and Nigeria, as well as CSOs and NGOs and grassroots monitoring of corruption-free primary healthcare.
Many reasons that we have discovered that corruption in healthcare, especially primary healthcare services, has to do with: one, lack of proper oversight on healthcare, primary healthcare. Some of them, the oversight function are vested on the state, and then some on the federal government. Some of the places where, and I think ICPC needs to look at, or if you are really looking, ICPC look at areas whereby we have insecurity, because we have discovered that places that have insecurity issues are places whereby most of these funds are being abused, because they know that your oversight may not get there.
Everybody is talking about primary health care is the main point. If you ask me, I will even say we need village health care. Because when you talk about primary, it's like a word kind of a thing. Me, if we can go down to the hamlet, it will reduce the pressure at the topmost level. And then our doctors at the secondary and tertiary will only be referred cases they cannot handle. So going forward, sir, we need an ethical revolution. We, the management that are seated here, particularly health professionals, whether it is health planning, pharmacy, medical records, and what have you, we need to be sincere with ourselves.
All the recommendations that have been made here today, I will be bold to say, are all things that are expected to happen normally at the primary health care center. The World Development Committees and the Village Development Committee are together, so that we only talk of World Development Committees, but in reality it's supposed to be the village, the grassroots development committees, and it's members from there that were now nominated to form the World Development Committee. So they look after their entire ward, not just one facility. But because of that negligence and that lead to investment at the lower levels beyond that. That's why I see all of them called greater umbrella sector. How they should be selected and how they should work is there. But the point is that nobody just follows it. When we come to the user charges, all the guidelines carry it. Display user charges where it is visible to all patients, even to the extent some will say with the language they will understand. But go to the many facilities, it's not displayed.
To have an efficient and a corruption-free healthcare, the media must be given access to information. Because without information, the media cannot act. And again, the media need a whistleblower because a journalist cannot be everywhere at all the time. Again, if as a journalist who covers the Senate for the National Assembly for my paper, will I have money to pay a whistleblower if he blows the whistle? Because the other time when they were doing whistleblower policy, government will promise people money. Where will I see the money to give them after blowing the whistle and giving me the information? So it is still the authority, like the ICPC, that can ensure that if a journalist has blown the whistle or somebody has blown whistle and he has gotten the information, that journalist is protected.
The media has a responsibility. We all have a responsibility, right, to be able to talk about these things, to ensure that health is in the front burner. And I think everybody needs to understand that it's a life or death situation. It's not a competition. It's not a witch hunting situation. It's not it's just about life. It's about life, really. So if we all understand that when I come to you as a journalist and I ask you about certain issues, you're able to open up to me and tell me what is happening. If I go to the committee chairman now and I ask him questions, please don't look at me like, okay, I'm coming to which one, I'm coming to put you on the spot. Respond to these questions. Let's understand what is happening so that we can name and shame or name and fame.
The critical stakeholders we have, I explained this just to put it in the right perspective, is that, yes, you have the NHIA, right, in the health insurance ecosystem. You have the state health insurance agency at the state level. And you also have the HMOs, who are like, if you like, for ordinary man, they are like the middlemen. Whether the funds through this, NHIs, for the scheme that will operate for the public servants, or the organized private sector, because we also have organized private sector on our database. A lot of companies, multinationals, have logged into National Health Insurance Scheme. That's a scheme that is different from the authority, right? That is one. Or, even at the state level, some of them also use the third-party administration, which is the HMOs. Now, once money is disbursed through these people, the money through the HMO goes straight to the facility based on the number of enrollees with them there. And they are to ensure that the quality of care there, right, is of high quality.
Corruption not in my country.
You see, I don't pity those corrupt officials. They are terrible.
All of them are thieves.
It's those small corruption that is killing this country.
Benny, it's true.
Greetings to you, sir.
Greetings, my brother.
From the power company. I discover you connected illegally.
It's not only me. Even Baba Femi here is connected indirectly. Even with our prepaid meter, he connected indirectly.
That is even more
Yarisika connected indirectly.
No. It is wrong to connect electricity illegally.
Young man, I have a son like you. You
are not supposed to offer me bribe. Bribery is corruption. Not in my country. Daniel, take off the light.
Yeah. Stop corruption now.
Corruption not in my country.
The highlights of the event were the presentation of the Corruption Risk Assessment Report by the ICPC Chairman to Honorable Minister of Health and signing of MOU between ICPC and the National Primary Healthcare Development Agency. Earlier at the event were goodwill messages from special guest Right Honorable Prince Kayode Moshood Akiolu, Chairman House Committee on Anti-Corruption and other key stakeholders who lent their voices on the best approach to improving the effectiveness of primary healthcare service delivery. Participants were carefully drawn from community health stakeholders across the FCT.
The federal government has done and continue to do a lot in various areas of our national life. Happily, the Speaker of the House of Representatives, Right Honorable Tajuddin Abbas, and indeed the entire membership of the House of Representatives have shown remarkable commitment to use the legislative instrument at their disposal to aid the fight of corruption.
The current leadership of the Nigerian Medical Association is committed to partnering with all relevant stakeholders, particularly the Federal Ministry of Health, and indeed the National Primary Healthcare Development Agency, to actualize a corrupt-free attainment of all set objectives aimed at improving the health of all Nigerians at the primary healthcare level. We believe that this conference will afford us the opportunity to offer suggestions and proper solutions that will assist in reducing to the barest minimum corruption at that level of care, not only among our members, but among all cadre of health personnel.
Tackling this issue is not just a necessity, but a moral imperative. The commitment of ICPC to reviewing systems, advancing solutions, and preventing corruption in the public sector aligns perfectly with the Nigerian Union of Journalists' dedication to ethical journalism and the promotion of transparency and accountability.
The incessant outcry by the helpless and poor segment of Nigerian society who have one form of disability or the other and in dire need of a healthcare support system to enjoy their health rights and as that same effectively should be a priority to the members of this gathering. As we strive to create an egalitarian society where human rights and disability rights are protected, promoted, and asserted accordingly, in order to end all forms of barrier, we must resolve to ensure the total compliance with the provisions of Discrimination Against Persons with Disabilities Prohibition Act.
Leveraging the WHO cooperation strategy for Nigeria, we reiterate our commitment to supporting the Federal Ministry of Health in improving the health of all Nigerian citizens. To this end, I would like to call on all stakeholders here present today as we hold ourselves accountable to healthcare delivery in our localities. Please let us stir up discussions that will bring sustainable recommendations to allow us reach all communities and everyone in Nigeria with the basic essential primary healthcare services.
The fundamental premise of primary health care, PHC, is primarily for people everywhere to have the right to achieve the highest attainable level of health. Primary health care enables health system to support a person's health needs, from health promotion to disease prevention.
Again, Nigeria continues to demonstrate it's committed to fighting corruption in different ways. This conference is one of those ways, by bringing people together to say, okay, these are the issues, how do we address them? And then taking that to kind of create the necessary impact in the lives of ordinary citizens.
Corruption in the health sector in Nigeria is a significant challenge that has far-reaching implications for the country's healthcare system and its population. This is just one of the many efforts being made by the Commission to enlist and foster public support in combating corruption in Nigeria. Thank you for watching this edition of the program. Let's steer clear of corruption and make the health sector and Nigeria great again. Bye for now. I am Murna Barnabas Atiya.